What tests are needed in the fourth month of pregnancy? As you enter the fourth month of pregnancy, which spans from week 13 to week 16, the number and complexity of prenatal tests increase to ensure the health and safety of both mother and baby. Here are the key tests typically performed during this period. 1. Ultrasound, mid-pregnancy fetal anomaly screening. This is a crucial ultrasound examination usually conducted around week 16. It allows doctors to closely observe the development of the fetus's head, face, spine, and limbs, checking for any structural anomalies. Additionally, it helps evaluate the growth rate of the fetus, amniotic fluid levels, and placenta position, providing essential information for managing the rest of the pregnancy. 2. Down syndrome screening. Between weeks 15 and 20, pregnant women are advised to undergo Down syndrome screening. This test assesses the risk of chromosomal abnormalities like Down syndrome by analyzing specific markers in the mother's blood, combined with information such as age, weight, and gestational age. While this test does not diagnose conditions directly, it provides important guidance for family decisions. 3. Routine blood and urine tests. Blood tests focus on counting and analyzing components like red blood cells, white blood cells, and platelets, to check for anemia, infections, or other conditions. Urine tests, on the other hand, assess aspects like color, transparency, pH levels, and the presence of cells, casts, or proteins, helping to evaluate the health of the urinary system. These are standard tests during pregnancy and help in identifying and managing any issues that may arise. 4. Blood sugar test. As pregnancy progresses, blood sugar levels can change. Conducting a blood sugar test during mid-pregnancy helps detect the risk of gestational diabetes, allowing for timely interventions to protect both mother and baby. 5. Weight and blood pressure monitoring. At each prenatal visit, doctors will measure the mother's weight and blood pressure. Weight gain can indicate the fetus's development and the mother's nutritional status, while blood pressure monitoring helps detect potential risks such as pregnancy-induced hypertension. 6. Fundal height and abdominal circumference measurements. By measuring the fundal height and abdominal circumference, doctors can preliminarily assess the size and growth rate of the fetus, providing valuable insights for ongoing pregnancy management. 7. Other auxiliary tests. Depending on the individual circumstances and the doctor's recommendations, additional tests such as trace element analysis, vitamin level assessments, and bone density tests might be needed to get a comprehensive understanding of the mother's health. Please note that the above-mentioned prenatal tests are for reference only. Specific tests and schedules may vary depending on the hospital and the attending physician. Therefore, it is recommended that pregnant women communicate with their doctor in detail before undergoing these tests and follow medical advice carefully.